So welcome. We hope you feel very at home here at the Medical Plaza building. I'm going to turn it over right now to our sponsor, Premier Imaging. She's going to tell you a little bit about the imaging services downstairs in the building. So thank you.
Thank you all for coming today. We're so glad that you're here, and we're so excited to sponsor these lunches for you all. So I hope you enjoy them. Just wanted to tell you a little bit about Premier Imaging. We're a freestanding diagnostic imaging center down on the bottom floor on the first floor. So just for your screening mammograms, annual screening mammograms, remember you don't have to have a physician referral for those, but you can just walk in and see us anytime. Also, we have CT, we have MRI, we have bone density, ultrasound, x-ray, and of course mammography. We also like to do corporate mammogram days for you all, for your companies. We like to go to your health fairs. So for the corporate mammo days, that's when your business can come see us, and we can pamper you while you're having your mammogram. So it's always fun to get pampered. So just be sure that you keep that in mind and ask us about this, and come over to our table to get some information about that. But we're glad to be here today, and we're glad you all are here to learn more about heart health. I'm going to turn it over to Pam.
Thank you, ladies. Again, we're so pleased that you're here, and we are very pleased to have the wonderful opportunity of having Dr. Kathryn A. McFarland speak to us today. Dr. McFarland is a cardiologist with Carolina Cardiology Cornerstone, which is a practice with 5 locations throughout the Triad, 15 providers, and I think that what's so wonderful about having Dr. McFarland speak to us is she is a woman doctor who is talking to women, and I think what is a very good way to put her approach and to give you a feeling of who Dr. McFarland truly is to read something to you that her partners, the gentlemen that she has practiced with for 7 years, recently said about her. What they said is, "We are proud of our colleague, Kathryn McFarland, MD, who for the past 7 years has helped the men and women of our community make healthy life changes through free screenings and educational presentations, and by facilitating donations of medical equipment for those in need. Her passion and commitment to fighting heart disease in our community is truly inspirational." And I think that after listening to Dr. McFarland today and asking her some questions, that you will believe that as well and know it to be true. Thank you so much again for your kind attendance, and I turn you over to Dr. Kathryn McFarland. Thank you.
How's everybody today? Good. Oh, let's clap for you guys. It's always a pleasure to speak to women, especially in this venue. I don't like a lot of formal speaking. I like informal speaking because I want you guys to be able to ask questions. I want you to really be able to hear what I'm saying to you and get it processed so that you will in turn be able to process it yourself and then help and share this information with your friends and your sisters and your moms and your children. That's what's really important is getting the message and then being able to turn around and share it with other people. What I want to start off by saying is that any question is okay. I'm going to try to remember to repeat the question so that the people in the back can have this, because this is going to be used for other companies to share with their employees. First thing is, when we look at heart disease, we want to break it down into risk factors that we can not control and risk factors that we can control. The two things that we have no control over is our family history, okay? Our mom and dad came together and made us, and we don't have any say-so in what our chemical makeup is. And a lot of times we inherit disorders, and we've got to be able to overcome these things that were inherited by controlling the things that we do have control over, okay? So family history is something that we can't do anything about. And our age is another thing we can't do anything about. Usually for women, once we get into the perimenopausal age, then heart disease really starts to develop in females. And that is if we don't do anything to hurt ourselves, like smoking, you know. Oftentimes smokers will start to experience heart disease sooner, okay? But usually after we start to lose our estrogen, that's a protective effect for the heart, then women start to have heart disease, okay? So those are the two things we can't control. What are the risk factors that we do have some control over? High blood pressure, diabetes, high cholesterol, smoking, our weight, okay, and our exercise, okay? So today you're going to hear some things that will hopefully motivate you. I guarantee you, you will hear some things that are going to challenge you and might even make you mad, but you'll overcome that, okay? All right? The first thing I want to talk about is body weight, and I'm not sure if they handed out body mass index cards for you. I'm not sure. We didn't? Okay. All right. Well, we tend to look at our height and our weight and how proportioned our body mass is according to our height. And what we're striving for is to be healthy. We want to be a healthy weight. If I had those cards for you today, you would find that a body mass index between 18 and 27, 28 is a healthy weight, okay? Anything over a body mass index of 28, you start to become overweight, and then 30 to 40, a body mass of 30 to 40, you are obese, and anything over 40, you are morbidly obese. So I know everybody knows roughly how tall they are and what they weighed the last time they got on a scale, but I'm going to let you know that the shorter you are, you have to be more in proportion. And if you're over 215 pounds, regardless of how tall you are morbidly obese if you've got a body mass index of 40 or more, okay? So we really have to be concerned about our weight. When our weight goes up beyond 27, that increases our risk for heart disease, okay? So you're 3 times more likely to have a cardiac event if you're overweight, okay? That goes up even higher as you fall into the categories of being obese and morbidly obese, okay? So for people with a body mass index greater than 32, you are almost 6 times more likely to have a cardiac event because you are obese, okay? That's huge, because that seems to be one particular problem with women that we have a difficult time controlling is our weight, okay? But I'm here to tell you that every woman can do something. You would be surprised the number of excuses I hear about why we can't get out and exercise, okay? It's too cold. Well, you know what? It's not cold in the mall, okay? All right, so you can get out and walk in the mall, okay? You can walk in Walmart. You can go to Lowe's or Home Depot. They've got real long corridors where you can walk, you know. My hips hurt. I had a hip replacement. Well, have you ever heard of water aerobics, okay? So just by doing some amount of physical activity, you're going to decrease your risk, okay? I also have some real good statistics that I'm going to throw in. 58 million Americans are overweight. 40 million Americans are obese. 3 million Americans are morbidly obese, okay? The worst body habitus is the apple shape, and that means that your weight is distributed around the midsection, okay? Doesn't matter if you're endowed up here or back here, it's right here that counts, okay?
Picture of that.
So that's really important. If you have a a apple shape where most of your weight is in the center, then you really, really need to work at decreasing your waist size, and that's going to decrease your risk for heart disease. Okay? So I also saw another statistic that I wanted to share. You know, we're always concerned about gaining weight, and especially that period from high school on. One article talked about gaining 20 pounds after high school, and if you gained 20 pounds after high school, doesn't matter how much after high school, you were 2.6 times more likely to have a cardiac event. Okay? What do you think happens if you gain 20 to 40 pounds? The risk goes up. It goes up to 7 times more likely by just adding 40 pounds onto the weight that you were when you were in high school. Okay? So we really have to work extra hard to maintain an exercise level that's going to keep our body size in proportion and at a healthy weight. Okay? How about any questions? Okay.
When you said 40 pounds, what was that percentage?
It increases your risk for a coronary event by 7 times. 7 times. Yes, ma'am.
What do they think the reason is for our, weight just like skyrocketing in America, the overweight in America?
The question was, what is the reason why we have increased Americans that are overweight? We would have to have a symposia on that particular question alone, okay? But I can tell you that our eating habits as Americans plays a significant factor. The last talk I gave, I told the women that in the 1960s, plate sizes were very different from what they are now. A saucer that we use now was the size of a dinner plate back then. Okay? Now we have platters that we're putting our dinner on, and some people need sideboards to keep the food on that platter. And then they have the nerve to go back for second helpings. Okay? So we are eating way more than we did 40 years ago. Okay? Also with the advent of more fast food restaurants, and particularly in underserved communities, all right? That's a huge, huge part of it. Another reason why is we're not keeping exercise in schools, okay? With all these cuts, what do? We cut kids' exercise and physical activity, and now they go home and they're sitting, they're doing this. So it's a multifactorial reason why we are the most overweight people on the face of the planet. Okay? Yes, ma'am.
If you slow your eating down and eat less and all, will your stomach shrink back? Because it's really out now. So will it go back?
Yeah. Eating is a very complex activity, but there's stretch receptors in your stomach. And when you eat very fast and you eat a lot of food, you stretch out your stomach. And then it takes more and more food for your stretch receptors to be activated for you to feel full. Okay? So if you eat a portion that is recommended and you eat that slow, your stomach is going to stay small. When you finish eating that, you're going to feel full. Okay? But we are a culture of overindulgence.
So you're just saying, should you adopt a method of like maybe counting while you eat or something?
I often tell my patients to count each bite 25 times and then swallow. By the time you're finished with your meal, you won't want any more. Okay? All right? So yeah, there's all kinds of tactics on how you can eat slow and decrease the amount of food that you take in. The next thing I want to transition to is talking about physical activity. I'm glad that we have a multicultural group of women here today. I am going to say something that's going to irritate quite a few of you. I'm African American, and African American women are the most sedentary human being on the face of this earth. We do not believe in exercising, okay? All right? And it's killing us, okay? I'm not leaving Caucasian women out because you fit into that category too. You are less active than your male counterparts, way less active, okay? So as women in general, we really need to focus back on physical activity, okay? Because we're not doing anything, okay? 78% of Americans are not meeting their basic activity needs, okay? 25% of Americans are completely sedentary. They get up, they eat, they go to work, they come home, they eat, they get on the couch and they go to bed, and they do it over and over and over again, okay? For women, usually when we get past the age of 30, our metabolisms start to change. And if we're not doing any kind of physical activity, we're guaranteed to gain at least 3 to 5 pounds a year. Okay? You do the math. Okay? So we really have to make that a priority. And again, it's not so much what you do, it's that you do something. Okay? If you park, the furthest spot away from your job and walk in, if you take the stairs, okay? If you walk on your lunch hour or walk half of your lunch hour, okay? There's something that we can all do, and making the smallest changes provide us with the biggest benefits, okay? So I can't stress that enough. It's really, really important to get moving and to stay active, regardless of what you do, okay? How about any questions? Nope. Okay, all right. One other thing about exercise, I often say that it's the cheapest medicine that we can prescribe for patients. When we exercise, we change our bodies so that we decrease our blood pressure, okay? We're decreasing the cholesterol in our blood, and we're decreasing our blood sugars, okay? So 3 of those risk factors that are so important for coronary artery disease are modified with just physical activity, okay? You can't beat that. That's cheaper than all of the $4 medicines on the Walmart list.
And the fourth one would be your mindset, the depression.
Oh, yeah. Yeah.
Psychological.
It does help psychologically. Stress is a big player in heart attacks. Most people, they know that, but to hear that most heart attacks happen on Monday, instead of Friday or Saturday, most heart attacks occur around stressful times like the holidays, okay? So we've got to be able to decompress, and there's no better way than exercising because you're burning up that energy, and oftentimes you take that time to let your mind just wander as you're doing your physical activity.
And it's not a workers' comp payable claim.
You're right, it's not. It's not. Okay. All right. Yes?
What do you recommend as far as how much cardiovascular or how much weight training?
Okay. The question was, what do we recommend for exercise, and in particular cardiovascular exercise? The definition of exercise is actually working out 30 to 40 minutes at a time, at least 4 days a week, okay? And you want to keep your heart rate at between 60 and 75% of its maximum. And how do we come up with that number? You take 220 minus your age, okay? And then that gives you a number, and then you want to take 60 to 75% of that and keep your heart rate within that range when you're exercising for those 30 to 40 minutes, okay? Cardiovascular exercise is what I always talk about because we want to make a change in your heart health, and your heart is a muscle that was meant to be dynamic. It was not meant to beat at 80 beats a minute, 24 hours a day, every moment of your life. Your heart needs to have heart rate variability. And so when you exercise and you get your heart rate up and then it comes back down, your body intuitively knows, right now I'm just standing at this podium, I don't need to have a heart rate of 120. I'm okay with 60. But then when I go to do some strenuous activity, it knows what it needs to kick in, okay? So that's the actual definition of exercise, and that's what we shoot for. Exercise for weight loss and bodybuilding is something different, and that really depends on the woman and her particular heart structure and anatomy, and that's a little bit beyond the scope of this Lunch and Learn, just because there are certain conditions where we don't want people doing a lot of heavy weightlifting because it's going to put more stress on the heart. So, but that's the definition of exercise. And so if you're not exercising 3 to 4 times a week, you're just physical, but you're not doing exercise, okay? So you really have to make that time commitment, and it doesn't have to be every day, it can be every other day. If you have weekends only, you can, do it, Friday after work and then Saturday and Sunday and get a couple of minutes in between, lunch, that kind of thing. But you really have to make a commitment to do that. And your body's going to need that on a regular basis, okay? How about any other questions about that? Okay, all right. The next thing I wanted to talk about is diabetes. That is one of the biggest risk factors for heart disease, okay? When you have diabetes, you are at an extraordinarily higher risk of having a heart attack. So much so that you're at more risk than someone who's already had a heart attack and doesn't have diabetes at all. That sounds weird to say, but for someone who has never had a heart attack or blockages, but they're diabetic, you are at extreme risk of having an event. And that's the big point. Yes, ma'am?
Why is that?
Several different reasons. Diabetes tends to affect your blood pressure, your blood sugar. You can have higher cholesterol. All of these are risk factors for actually having heart disease. And if you're not taking care of your body, then you're going to start to see those effects, okay? It used to be that people would just have diabetes, but now they're starting to acquire other risk factors because of lifestyle, okay? And they're starting to see it sooner. So much so that we're starting to see a lot of children that are diagnosed with type 2 diabetes. Type 2 diabetes is a later onset, okay? And the longer you have diabetes, then the more at risk you are for having heart attacks. So can you imagine being a child with type 2 diabetes and having that for 20 years, and now you're 30 and 40 and you're having a heart attack already? Okay? So it's very, very important that we recognize that diabetes as a risk factor increases your risk for heart disease in and of itself. Okay? How many in this room has a family member that has diabetes, or someone that has diabetes? I mean, there may be 1 or 2 people that did not raise their hand. Okay? So it's very, very important. And again, with diabetes and those high blood sugars, how do we help modify that risk? By exercising. That's going to lower your blood sugar level. And when we can decrease your blood sugar level, your sugars are going to be under better control, and you're going to decrease your risk for having a heart attack. Okay? All right? So 8 to 9% of women in the United States, 20 years or older, are affected with diabetes. It's a pretty big number. Okay? Of course, African Americans, Asians, Indians, Pacific Islanders, they are at increased risk, okay? And a lot of that is lifestyle, not exercising, poor choice in food and food preparation, okay? So it's one of the biggest problems that we deal with. Diabetes, 2 to 4 times higher rates of having a cardiac event than anyone that does not have diabetes. Yes, ma'am.
You hear people say that having diabetes masks symptoms. What does that mean?
She's asking about whether or not symptoms of heart disease and heart attacks are masked with diabetes. Diabetics have a lot of different problems, unique problems. When someone has heart disease and heart attack and pain in their chest, it involves nerves, okay? And your nerves are letting you know, not nerves up here, but nerves that tell you, okay, I'm having pain in my chest. Well, oftentimes, diabetes affects the nerves of your body. And the higher your blood sugar levels are, then those nerves are not able to do their job and to signal that there's a problem. So it is very common for diabetics to have silent heart attacks, and they don't have the same symptoms that someone who does not have diabetes might experience. Okay? That's very, very common. How about any other questions? Okay, all right. The next thing we're going to talk about is hypertension. Hypertension is a big risk factor. It's not as big as diabetes, but nonetheless still important. 75 million Americans have diabetes or have hypertension. 1 out of 3. So, 1, 2, 3. I mean, very, very high number of people. And I'm not talking about the blood pressures that are in the stroke range that are 200, over 100. I'm talking about blood pressure that is 130 over 85 and higher. So if your blood pressure is above 130 over 85, you've got stage 1 hypertension. Okay? How do we treat blood pressure? Again, I go back to the cheapest thing that we can offer is exercise, because exercising is going to lower your blood pressure. Okay? The good thing that we can do is lower our blood pressure. When we can decrease that top number by 20 points or that bottom number by 10 points, then we decrease your risk for having a heart attack and a stroke. Okay? So making very small changes is going to have a large impact. Okay? Your doubled risk of having death and a heart attack are decreased just by a 20-point change on the top and a 10-point change on the bottom. Okay? Losing 10 pounds reduces your blood pressure. Having a diet low in fat and low in salt also decreases your blood pressure. Having less than 2 drinks a day decreases your blood pressure. If you have more, it increases. Okay? So stay at 1 or none. Okay? All right? So when we talk about high blood pressure, there's something that always comes up. and it's sodium intake. What's the right amount of sodium for somebody that has high blood pressure? Okay. For Caucasian women, 2,300 milligrams of sodium a day or less. Okay. For African American women, it needs to be 1,500 milligrams or less. Okay. All right. And a lot of that is food preparation, and that we respond differently to sodium. Okay. So really, really have to be careful the amount of sodium that you're putting in your body. Canned foods you want to steer clear of because the food is preserved with sodium. Okay. Microwavable meals, and we love those things. You know, we carry them to work. They're small, they're cute. You know, it says 270 calories on it. We like that, but then you look down and it's got 800 milligrams of sodium in it. Okay. So there's certain things that we just need to steer clear of. Okay. All right. How about any questions? Yes, ma'am. The question was, what about coffee and blood pressure? Coffee has caffeine, and caffeine raises your blood pressure. Okay. Does that mean that you that you can't have coffee ever again? No, it means that everything in moderation. Okay. And if you're a coffee lover and you want to have 2 cups, you know, you might have to do a little bit of extra exercise. You know. Okay, but you really have to watch the caffeine that you ingest, because it's not just coffee. It's sweet tea, it's green tea, it's over-the-counter cold and flu medicines, herbal supplements, chocolate, like she said, diet pills. It's, you know, all these things are stimulants, and they can raise blood pressure. Anytime you are raising your heart rate, you are raising your blood pressure. Okay? So you really have to watch those stimulants and whether or not they increase your heart rate, because it's going to increase your blood pressure. Okay.
So if you raise your blood pressure in exercise, that's a good raise?
It is, because over time your body is going to get used to varying heart rates. Okay? But we're talking about isolated things that will elevate your blood pressure. So you're conditioning your heart when you exercise. Okay?
And what about decaf coffee?
The question was, what about decaf coffee? Decaf coffee is still coffee, and it still has caffeine in it. It's just a reduced amount. Okay? Yeah. Yeah. Okay. How about any other questions? You guys really like your coffee, don't you? It's okay. That's all right. All right. The next thing we're going to talk about is high cholesterol. Okay. 105 million Americans have cholesterol greater than 200, and that's the total number, the total cholesterol. Okay. 42 million Americans have a total cholesterol that's greater than 240. What's so bad about that? What's bad about that is that puts you in the high-risk category for heart disease and having a cardiac event when your cholesterol is that high. Okay? So we really have to control what we put in and what we take in, because part of family history can be high cholesterol. And you can do everything in the book. You can exercise, you can diet, but you may still have high cholesterol because it's coming from your family history. And in those circumstances, medication is going to be needed to get that cholesterol down so that your risk for heart disease is decreased. Okay? Triglycerides are also very important. What are triglycerides? Triglycerides are all those things that as women we love. Pasta, bread, potatoes, rice, yeah, exactly, everything white. All those things that we just have an affinity for, okay? And in particular, it affects women, the triglyceride level, and it can make the composite of the blockages that line your blood vessels more atherogenic, okay? It doesn't seem to hold up for men, but triglycerides are really important to control for us. And of course, triglycerides are all sugars, and then what happens? Our blood sugars go up, we start expanding, you know. So it's really important to limit your carbohydrate consumption. Now, there's two numbers that I want all women to be aware of. When you go get your regular physicals and your doctor does blood work on you, what you need to know are two particular numbers. One is the HDL. HDL is the good cholesterol, okay? And that number needs to be around 50 for women, okay? If it's less than 50, that's an independent risk factor for heart disease, okay? So how do we get that HDL up? Exercise, okay? And red wine or grape juice, that kind of thing, okay? Or medication. The second number is the LDL, that's the bad cholesterol, okay? Depending on how many risk factors you have for heart disease will determine what that number needs to be. If you're diabetic, that number needs to be less than 70, okay? If you have heart disease, you've had a heart attack before, you've got blockages, that number needs to be less than 70, okay? If you have 2 or 3 risk factors for heart disease, 100 or less, preferably 70, okay? If you don't have any significant risk factors, then that number can be around 130 to 160 depending on your age. The younger you are, it can be higher, okay? So when you get your blood work done and you get a phone call from your doctor's office saying, oh, all your blood work was fine, you say, hold up, I want to know 2 things. I want to know what my good cholesterol is, the number, and I want to know what my bad cholesterol is. And if you have more than 2 or 3 risk factors, then you need to have a conversation with your doctor about starting you on something, okay? Because it's all about decreasing your chance for a heart attack, okay? So that's very, very important. Questions on cholesterol? Yes?
Are there any holistic or vitamins or something that would be good for someone to take that doesn't like traditional medicine? They tend to make you feel really bad. So.
Well, that's a yes. Yes, there are things that you can take. Flaxseed and fish oil, okay, and niacin. Those are things that you can do that are not technically medicines that also help with lowering your cholesterol. But if you have a significant family history of high cholesterol, those things aren't going to cut it. And you may need to have medicine. Otherwise, you're going to put yourself at increased risk. Okay. Yeah. 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 But there's ways around, you know, flushing. A lot of times what we have our patients do is when they take niacin, if they take a half of an aspirin 30 minutes before they take niacin, it will help to relieve the flushing that they feel on their face.
Regular aspirin?
Yes. Okay. All right. Yes, ma'am.
What about red yeast rice?
It helps. Someone asked me that at the last talk I gave, and it's okay, but I think that flaxseed, ground flaxseed helps more. You can get a bag of ground flaxseed at Harris Teeter or Walmart for $2 or $3, 2 tablespoons a day. The ground flaxseed helps to absorb the cholesterol that you're ingesting and can have a pretty decent effect on your cholesterol numbers. And it's cheap.
Mix that with cereal?
Yep, you can have it with cereal in the morning. If you bake muffins, you can put it in your muffin mix, sprinkle it on your yogurt and berries, that kind of thing. Yes, ma'am? I'm sorry, she was asking about red yeast rice, and a lot of times people take that to help lower their cholesterol as well. Yes, ma'am?
You have a lot of people taking like a baby aspirin a day.
Y-
Is that okay to do?
The question is it okay to take a baby aspirin a day? It depends on the number of risk factors that you have. If you have a significant number of risk factors for heart disease, then yeah, you're going to benefit from taking an aspirin a day. An aspirin helps to make the platelets that are in our bloodstream real slippery. It deactivates them so they don't work well. And if someone is in the process of having a heart attack, that's why we get them to chew aspirin, because it gets into the bloodstream right away and it can help to unclump those platelets that form that are making a blood clot. So yeah, so it really depends on if you have a lot of risk factors. If you just have high blood pressure and it's under good control, no. If you're diabetic, you have high cholesterol and hypertension, going to want you on an aspirin. Yep.
Now, what if you don't have any of those symptoms, but it's a family history?
A family history of heart disease, then you should get one of those little red containers. We have an aspirin in the little health kit. And if we don't have, if we don't have enough of those, we can maybe get some to you guys. It has an aspirin in there, so you should always carry that in your purse or in your wallet. If you have symptoms that are concerning for heart attacks, then you would want to open that up and bite on that aspirin, okay?
Also, we're taking all those aspirins and the flaxseed and all this stuff. Will that damage the liver? Because everything has a side effect. So I want to know if that natural stuff, and if you take it over a long period of time, would that eventually damage the liver?
The question is, will all of these medications and supplements for cholesterol damage your liver? And the answer to that is it can. And when we prescribe medications that work through the liver, we always test our patients to make sure that there's no damage of them, having that medication. So if you're on a statin medicine that helps with cholesterol, then at least once a year you should be having your liver function test to make sure that there's no damage. If you're taking herbal supplements, you need to let your physician know so that they can properly test you, because those are not FDA approved medications. They're supplements and they could always have an effect on your liver. Okay. All right, I'm going to try to blow through some of these other things. Smoking. How many people smoke in this room? One? Two? Couple? Okay. All right. Smoking is a risk factor that is trying to rival diabetes as the #1 risk factor for heart disease. Okay. Smoking is detrimental to your heart. I can't tell you how many times I hear patients say, "Oh, well, doc, I'm not a big smoker. I smoke less than half a pack a day, or I smoke 2 cigarettes a day." Well, it's really an all or none phenomena. And if you are smoking 1 to 14 cigarettes a day, you are 2 times more likely to have a heart attack than someone that doesn't smoke. If you're smoking over 14 cigarettes a day, that risk goes up to almost six times someone who doesn't smoke. You are at risk of having a heart attack. Okay? So cigarette smoking is just, it's one of those things that it's a bad risk factor. and it seems to affect women more so than it does men. We tend to be smaller than men. Our hearts are smaller, our blood vessels are smaller, and it can ravage the female body. A lot of times, women that smoke have problems with not only blockages in their heart, but blockages in their peripheral arteries, so arms and legs. And if we can't walk, we can't do anything. And a lot of times these blockages occur in the legs, and then you need stents in your legs so that you can continue to walk, and it's because of smoking, okay? So that's one of the worst things that you can do to your body is smoke, okay? Secondhand smoke is bad, but this is worse, okay?
It's right next door to
Okay.
3 feet away from.
Yeah, there's just no other way to say that it's bad. It's bad. We don't need to be doing that. Let's see what else I want to highlight here. We had touched on stress a little bit and depression. Psychosocial stressors in women are huge. There was a study done, and it looked at women who are at most risk of having heart attacks, and it's usually women that are married. That's right, you know, or living with a male partner, okay, you know. So what we really need to do is we need to be able to combat those stressors. And, you know, again, I go back to exercise, but it's so important. We really need to be in control of our own health, and a lot of times women tend to put everyone else first, and that's hurting our families, okay? It's actually a good thing to take yourself serious and give yourself that time that you need to exercise on a day-to-day basis, and your children are going to see that, so you're modeling good behavior for them. And you're preserving your family, because if something happens to you, the whole house of cards collapses, okay? You know, so we really have to put ourselves first and exercise and have that dedicated amount of time that we can work on ourselves so that we can be better moms and grandmas and aunts and all that kind of good stuff, okay? How about any other questions before we wrap this up? Yes, ma'am.
The red wine, let's touch on that.
Okay. Yeah, grape juice is good. I don't do a lot of drinking, and it's kind of hard for me to recommend that, but it is something that is acceptable. Okay, so you know, and it's 1 glass. It's in moderation. Yeah, and it's not a big glass. Yes, 4 ounces of red wine is acceptable, and that will help to boost your HDL, okay? But, again, it's 1 glass, and when you start going over 2 and 3, then you're increasing your blood pressure, you know, so you're getting rid of the beneficial effects that you would get from 1 4-ounce serving.
And if you take your medicine with grape juice, it doesn't have the adverse effect that grapefruit juice.
Yeah, no, completely different, completely different.
One more question.
Yes.
I have insomnia really bad,
Mm-hmm.
and I was told or read something about, because I don't get but maybe 2 to 3 hours of sleep a night, maybe.
Mm-hmm.
But I was told that if I continue with this chronic sleep problem,
Mm-hmm.
that I stand a high chance of a heart attack. Is that true, or?
You know, all of this contributes to stress, you know, and if you're trying to work off of 2 or 3 hours of sleep and handle everything that you need to handle, then, you know, it's not going to be good. So I don't know, do you exercise?
Not as much as I should.
I bet you if you start exercising, you'll get more sleep. You'll get more sleep. If you're doing 30 to 45 minutes 4 times a week, you're going to sleep. Yeah.
Well, I used to teach aerobics,
Okay.
And I would try not to teach too late at night because the endorphins and everything, I would be pinging off the walls.
Yeah.
But I've been in 2 sleep centers, had numerous tests. And
Yeah.
I don't know why, but I just can't sleep.
So in that very individualized problem, you want to make sure that everything else is under control. Blood pressure, cholesterol, blood sugars. Okay. Well, thank you, ladies, for turning out today. I hope you enjoyed yourself. I hope you learned a lot. And please share it with those people that you love.
I just want to say thank you again for allowing us to bring you these programs once a month. We do hope that you find them helpful, and we do hope that you feel armed with a little more information on how to better take care of yourselves. And I do like what Dr. McFarland said. We need to have as much control as possible over our own health, not only for us, ourselves, but also for our families and our loved ones.